So this pandemic is in every single country that we work in. It has hit the rich countries first because we are countries that do a lot of international travel, but but it's hit every single country, and the devastation in the developing world where there are very weak health systems, fairly weak communication systems, is going to be far more devastating over the next 4 to 6 months than it is even in the US, which is currently the worst epidemic in the world. So fortunately, as Saida Hamid, our board member, said on a recent board meeting, the Hunger Project is uniquely positioned to play a very important role in this pandemic. If you think of our three pillars, start with women. Women are at the forefront of the response to this pandemic. Mobilize everyone. Everyone has to get the word about social distancing, about isolation, about knowing the symptoms. And third, getting local government to work. We have to have, as our lead animators and volunteers and leaders all around the world in the Hunger Project, they all have strong relationships with their local governments, or many of them are sitting in their local governments. And so when a person is affected by this disease, they need to be isolated, they need to be treated. Our people need to know what to tell people in terms of social distancing, in terms of hand washing, in terms of, and they need to be able to access resources to care for people who've been whose livelihoods have been disrupted by this pandemic, who have no access perhaps to food at all, people who are housebound or elderly or otherwise incapacitated. So linking people to the resources that are rightfully theirs is the job of local government. So our three pillars, starting with women, who are going to be also most affected by this. I mean, when there's a crisis, there's more child marriage, there's more domestic violence. So all the kinds of work we do to ensure women are in the forefront, that their collective voice is being heard, that they are at the forefront of mobilizing everyone, and that people have the right kinds of links to their local government for treatment, for relief. All those things are going to be critical. You know, there is no cure for this. There's no vaccine yet, but the actions of the Hunger Project to have people take personal responsibility for halting the spread of this pandemic, that's what's needed. So on today's call, we're going to hear from some of our leaders that are leading their national response in the Hunger Project to this pandemic. We'll first hear from Dr. Daisy Omogoshu, and that'll be in interview format. I get to interview my friend and colleague Daisy. And then we actually have a video message from India, from Rita Serene, that Sarah will play for us. So that said, Daisy, if you could unmute. And the first question I have is, overall, how are our community partners doing? I mean, that's so many of us have traveled, so many of us have met our community partners. What are you hearing from them are the challenges that they're facing?
Okay, thank you, John. Is it good afternoon or good morning, everyone?
It's both of those.
One thing yes, the one thing I can say is that our partner communities are really doing just fine. And it's like they were prepared to handle such situations. Yes, I know we have, like in Uganda, we have 53 reported cases. And these are in 11 districts. And in Hunger Project, we are working in 3 out of those 11 districts. So we have some reported cases in Wakiso, we have reported cases in Mpigi and Iganga. Wakiso and PG surround Kampala, and most of the tested people, the positives, are people who had traveled outside and came and maybe infected their families. We haven't had any person from the community, somebody we know with our communities, but it is the cases are within the districts where we work. So we are being more vigilant to make sure that it doesn't extend to our community members. So the preparedness, the communities are fine. Our epicenters are doing great. They are one of the most utilized spaces in terms of being there timely. They are within reach of communities. They are offering good quality services within the given environment. And we have actually got some influx, in some cases, influx of patients because they can't go maybe to other health centers which are far or something like that. Our rural banks are like a savior. People are withdrawing. Those who had saved, I think saving was a great, it couldn't come at a better time. So we are seeing some people withdrawing and being able to meet some of their needs. And the other program that couldn't be more handy is our WASH program, the water, sanitation, and hygiene. These are now the recommended practices which people are relying on: hand washing, having the TP taps, and also maybe even making local detergents. So all these are really, we can say that the community is much more prepared. The only challenge, the only issue I can say, yes, yeah, they are coping, but in a way, like every pandemic, they are also scared. There's a lot of uncertainty. There's some stigmatization. If somebody says you've traveled, you went out of the country, people tend to even maybe distance themselves much more than how they would do normally. And in some cases, some community members maybe would say they can turn like violent because they feel like somebody, if we travel, they feel like maybe you shouldn't be within the community. They report cases of people who have traveled. So they are coping, but there are some of those issues. And of course, there's limited transport. We are under quarantine. So transport, especially for maybe like people who are sick, that may be a challenge. If they can't move and they needed maybe a vehicle or something, this one they have to get authorization from the resident commissioner. And of course, most businesses are also closed, but people within communities like roadside markets are operating, although there are reduced prices for vegetables and maybe most of the perishables. Generally, there is a decline in activity. So some of the challenges, I can just speak a few voices, yes? One of the voices I can say was somebody from Mbale, who says, I miss going to the epicenter. At least for some of us, this was our happening place for interaction with the friends, for learning, for a lot of things. Now we can't move, we can't go there. We are not even allowed to move anymore. So we live in fear and only cling to hope. So I think that's one of the voices. I have some few voices. Maybe if I have time, I can go through them. But that is the situation as of now.
Wow. So, Daisy, tell us some of the creative and innovative ways that our staff and our epicenter committees and our animators are, in this kind of lockdown situation, innovative ways that they're reaching people with the kind of information and correcting the misinformation that's out there. How are they communicating?
Yes, we have had to be very creative in so I think such a short time. One of the first things we did was the creation of a crisis response team, both at the Hunger Project office to coordinate everybody in relation to the pandemic. in terms of what we could do, redrawing the plans, getting to people messages and all that. So we have a response team within the Hunger Project office. But we also have the response teams within each of the epicenters. These are composed of 7 members, which include the epicenter leadership, the animators, the district official, a sub-county official, and the community development officer. So this mainly they are to disseminate the relevant information so that people are not misinformed, and to make sure that information is passed around, and also to generate the responses from the communities. What are the communities saying? What is going on? Are they getting the message right? Is there which is not something which is not clear? Are they getting some misinformation somewhere? So that is the team that is responsible for that. And of course, the staff also are doing their part in terms of now working virtually, making reports, looking at new ideas, ways of communicating with the district. But mainly, we are trusting the community to run the epicenters during this crisis with the minimal supervision, and trusting them as the key contact information sources. Because as you have just said, we also want to transmit or to put the staff in danger. So we are doing virtually, and they make sure that the communities are doing this. In addition to being part of the response team, we also see epicenter committee members running some of the programs, like making sure the food, this is a rainy season, making sure that people are actually planting, because when we come out, I think we'll still need to eat.
Yes.
Some are doing door-to-door deliveries. For example, some people who can't move, especially like maybe HIV patients. Some are sharing resources, like the only things which are allowed are bicycles and motorcycles. So people can share. They can say you can use the motorcycle for the chairperson to move, or even maybe some of the cashiers.
Right.
For the animators, they are doing more of, again, the supervision and taking the information, supervising the social distancing. Are people actually gathering or not gathering? Do they have the tippy taps? Are they washing hands as recommended? Are they maintaining, and are they maintaining other hygienic practices? So these are what the animators are doing. And of course, they also maintain the demonstration gardens at the center. The other aspect has been on social media, trying to use, learning how to use the social media, creating WhatsApp groups, both for the staff, between the staff and the animators and the center leadership, creating for platforms also for similar groups. Like we have platforms for the peer educators in her choice program to get, and also the deaf girls, to make sure we get information on what is going on there. And of course, we are leveraging the epicenter resources also. Most of the, I think, epicenters, we use the community hall when we have more people for social distancing.
Right. So Daisy, I know that you and your team in Kampala have been working really hard to influence national policies and national government. How has that work proceeded during this pandemic?
Yes, we are, as Hunger Project, working with the other like-minded organizations. We are part of the community-led development Uganda chapter, and we've been working with the government of Uganda, supporting, inputting into the ongoing development of the National Development Plan 3, which will be running from 2020 to 2025. So we've been part of that process. And for some of you, the National Development Plan is the government's strategic plan for the next 5 years, which specifies the roles, what we need to focus on as a country, across sectors, across ministries. And for the first time, it includes community mobilization. So that's where we come in very handy, and also mindset change. So now that the COVID pandemic is here, we see this is serious, this is a national issue, and it requires all actors to work together. So
Yeah,
in the project, we are working closely with the government at the district. As I've just said, we have the response team, and to ensure that all the standard operating procedures are followed. But also at the national level, we are working with the Office of the Prime Minister under the NGO Forum, the Uganda National NGO Forum, to support where we can and where we are needed to give our expertise. Our expertise is coming in handy, especially in community mobilization and sensitization. So here we are looking at rapid dissemination of accurate information and also
right.
guidance on what to. And we are working with the chapter members also where we can't reach. So our chapter members are also doing the same where Hunger Project is not. And yeah, the epicenter leadership is also supporting government in identifying food stressed households in case they are there in their communities so they can receive our government support.
Great, Daisy. Thank you. Um, a message to Sarah. Sarah, with now that my screen is filled with all these faces, I can no longer see the chat screen. So when we get to Q&A at the end, and if you all can get to your chat screen, you can send questions, and we'll get to those after we hear from Rita in just a moment. So Daisy, thank you, and our blessings and best wishes to everybody in Uganda in this struggle. I know, Africa actually, when you mentioned preparedness, I mean, parts of Uganda have struggled with Ebola and with SARS. So there is some preparedness, and the rest of us are struggling to learn some of those lessons. So it's great to hear what the epicenters are doing, what you're doing at the national level. I saw a question flash by about the international organizations such as WHO. I know they work very closely with the Ministry of Health in Uganda to make sure that the right messages are the right messages. So and I'm sure you're in touch with when you were mentioning the chapter members, you're mentioning both local organizations and big informations. Bridge is asking, how do villagers getting information? So I presume you're using phones to reach the epicenter committees, and they're just using what, community radio and loudspeakers, or how are people getting information? Bridge wants to know.
I answer now?
Yeah, please.
Okay.
And then we'll go to Rita.
Okay. Yes, definitely. Hunger Project, we can't work alone and we can't reach everybody alone. So we are working with the other organizations. We are working with some of the local organizations which work at community level. Those are
Right.
mainly the members of our community-led movement chapter. But we are also working with other bigger organizations like the World Vision and others to make sure that our communities are safe, they get the right information, and those who are distressed also get support. In terms of information, yes, we have a good number of people have mobile phones where they can get messages. And these are taken as messages. But where they are not, we also use, is it mobile radios or loudspeakers, where somebody can go through a village with a speaker,
Right.
taking the message to the communities. So, and also there are radios everywhere. So there is enough information really in the communities.
That's great, Daisy. Okay, well,
Okay,
Sarah,
somebody is asking the issue of the deaf girls.
yes,
The deaf, we have a project for safe choices for deaf girls. And these ones, they've teamed up, they've put under one application to make sure they share information on hand washing, on what to do in the case of any pandemic. And also it is easier in pictures because they cannot hear. So it is generally tailored to their, maybe to see rather than to hear. And some of them are using their parents' phones, those who don't have, or somebody, the neighbors or something like that within the community members. So it's an app which is bringing them as peers with one common problem because they cannot hear maybe most of the messages. They can only read and see, so it is tailored to them.
Right. Okay, well, we're going to turn now to India. A lot of people have been seeing the news in the papers of the massive lockdown in what is either the first or second biggest population in the world in India. And so, Sarah, if you could play the India video, that would be great. We have a video message from Rita Serene, who's a global vice president and a country director for India. And we'll hear from her now, a recorded message.
Good morning to everybody. I'm Rita Sareen. I am the Global Vice President of the Hunger Project and also the Country Director for India. I know these are very challenging times. These are very difficult times when each one of us is dealing with disease, fear, and a threat to our lives. In these times, each one of us are trying our best to be able to be effective, to be able to reach our community, our constituency. In the Hunger Project in India, we work with the elected women leaders to village councils who work in their communities relentlessly towards the end of hunger, bringing water, health, sanitation, education to their communities, their families, their villages. But now, in this situation, currently, it is a challenge for them. And Hunger Project in India decided very, very early on that we are going to turn this challenge into a great opportunity to reach out to every elected women that we work with in our areas, and that elected women will reach out to each and every person in her village, in her family, in her community with the entire message of COVID-19, what it is, what needs to be done, what needs not to be done, who needs to be contacted, how the message has to go, and what are the challenges. We created very early on. I repeat the word very early on. We created very early on WhatsApp messages which went out immediately through our chain of team, staff, people who work on the ground, our partners, to every elected woman leader we interact with, we work with, we partner with. Now, how does that woman take that message forward? It's so beautiful. She reads it out to her community. She stands there and reads the message out. This is the best way. It's the best way to reach to your people. We also simultaneously sent messages to the community through the elected women leader that what are the myths which needs to be busted, beliefs which are not correct in order to treat the disease. So the elected women leader, the adolescent girls that we work with have already become barefoot soldiers on the ground with every bit of information which they need to know, and they need to carry it to their community. We did marathon phone calls. There is a lockdown that we all are aware of, but there is no lockdown on communication. There's no lockdown on talking. There's no lockdown on inspiration. There's no lockdown on thinking. There is no lockdown on creativity. There is no lockdown on hope. So every elected woman leader in her village is becoming that optimum of hope. She is carrying the messages. She is doing door-to-door information sharing. And the WhatsApp messages are in all the languages, because in India we have many languages where we work in. What is our motto? It's not been long that we have done this, just a week or 10 days. The motto is very, very clear. Reach out to the last person who needs to know what is COVID-19 and what needs to be done. Reach out to the last person who needs to have a hope that he or she will be taken care of, is protected, because he or she knows what is the truth and what needs to be done in times like this. Please go. Do not wait. Now is the time. Reach out to the last person who needs to hear you. Thank you so much.
Thank you, and thanks for getting it to play, Sarah. That really appreciate all the work to set up this call. We've got just a couple of minutes left. If there's one question that's come in, Sarah, that you want to read out, and perhaps I or Daisy can address. If not, I'll just give some additional briefing information before we close. Anything, Sarah? You're muted.
Yep, I'm muted. Let's see here. I hadn't seen any other questions that went unaddressed. Let's see. Bridge has asked, the reported hotspots in India seem to be in or near big cities. Have we heard of any outbreaks in the areas where we work in India that you know of?
I mean, what we have to realize at this point is that it's going to be everywhere. So it's, it has moved more slowly, but it will be everywhere. So the kind of lockdown, on other calls, Rita has talked about really how pleased people are with the strong lockdown commitment by the government to move fast and to get that lockdown to happen. That will slow the spread, but the spread is going to happen. And so hopefully it will have flattened the curve to the point where it's not as devastating as it could have been without that lockdown. But all of our countries have cases. All of those countries are projected to increase before they get better. So the prediction is there will just be lots of devastation throughout the countries with the poorest, weakest health systems, including India. So the only other thing I want to let you know is that our program leaders are meeting together and sharing what they're learning with each other. We have very frequent meetings with teams around the world to keep our own spirits up. Can be a very emotionally wrenching time. And so our interconnectedness, our solidarity, our love is needed both for our own hearts and souls, as well as for those of our partners around the world. So I just want to express my deep appreciation to your support, your emotional support, your love, your financial support, your solidarity. It is really making a difference. As Saida said, we are in a unique position to play a very big role, both for ourselves and through the movement for community-led development and our links with WHO and UNICEF and these agencies. What we're doing and learning we are determined is going to contribute to the whole world. So thank you for your partnership, for your support, and there will be more calls. There's going to be one on Earth Day on April 22nd, a very important holiday in the Hunger Project, also my wedding anniversary. So that's coming up. And any follow-up questions, be in touch with your fundraiser. And as we mentioned earlier, but some of you weren't on at that time, if you want a link to the recording, contact Sarah, no H, sarah.wilson@thp.org, and she'll send it to you. Okay, everybody, thank you. Stay safe, stay strong, stay healthy, stay loving. Bye for now.
Thanks,
Bye-bye.
everyone,
Bye-bye.
so much for being with
Bye.
us
Thank
today.
you.
Thank you, Daisy,
Okay,
so
bye.
much.
Bye,
Thank you,
everyone.
John.
Bye, everybody.
Bye, everybody.
Yeah,
Lots of
thanks, John. Thanks, everyone.
virtual
Bye,
hugs.
Bridge.
Virtual hug.